we will welcome our next session speakers. So we have a special panel of experts who are going to give us a broad look at different careers within the behavioral health field. So we're going to welcome Dr. Jerrica Matyas, Dr. Jerrica Pitzen, and Dr. Heidi Martin. I hope I didn't butcher everyone's names too terribly. Dr. Matyas is a researcher in experimental psychology and behavioral neuroscience. Dr. Pitzen is a clinical psychologist focused on parent-child relationships, and Dr. Martin is a clinical psychologist specializing in assessment in adult relationships. So together they're going to share their journey, research interests, and insights into what it's really like to work in the behavioral health field. So welcome, everybody.
So it looks like my video might not be working, so I will troubleshoot that, but I figured I would just kind of introduce us a little bit to add on. So my name, of course, is Dr. Heidi Martin. I am an assistant professor at Rochester Christian University in the psychology department. So as said already, Dr. Jessica Matyas is the psychology department chair and associate professor, and Dr. Jerrica Pitzen is the director of the clinical psychology master's program and assistant professor. So our plan for this session is for each of us in turn to kind of describe how we got into the field of psychology, what interested us, and then go into what our day-to-day work in this field looks like. And then we'll field any questions that anyone might have for us. So then I believe Dr. Matyas was going to get us started. So if you'd like to go ahead.
Thank you, Dr. Martin. Yes, I also had some technology issues earlier, but I'm happy to see my microphone is finally working. So I am Dr. Jessica Matyas. I am the chair of our undergraduate department here at RCU. What initially got me into psychology, I was one of those kind of wandering students as an undergrad. I started studying psych because I took a gen ed, and I'm like, oh, this is actually really interesting. And then my senior year of college, my mother was in a car accident from a negligent driver, sustained a C5, C6 spinal cord injury with incomplete paralysis and loss of movement, but not sensation. The immediate response that she had from all of her physicians was so generalized and sort of ignoring the fact that she had an individual case that I sort of made it a bit of a personal mission to advocate for individuals and the differences that people had between their diagnoses. I did not like the fact that she had been treated like a paragraph in a textbook rather than a person. And the more I spent studying psychology, the more I started to realize that a lot of people who had been othered by society were experiencing very similar things. From there, I continued studying behavioral neuroscience with a specialization in traumatic injury to the brain and spinal cord. I even did some specialized training with my postdoctoral degree in pain signaling. So a large part of my research has been, of course, experimentally focused using animal subjects, mostly rats and mice, with some extra attention to the behavioral aspects of how people can benefit from these things, especially when it comes to things like sensation and perception, the way that people's behaviors reflect the things they are dealing with underneath, such as chronic pain. In terms of my general day-to-day type of function, I fell into teaching sort of as a case of my advisor saying, you know, I'd like to take a sabbatical. Would you teach this class for me? Absolutely fell in love with it. And so I spend a lot of face-to-face time interacting with my students, answering bizarre questions. The weirder, the better. They are my absolute favorites. And generally helping other people understand the different perspectives of the people that they are going to be working with from day to day. From here, then, I will pass over to our graduate director, Dr. Pitzen.
Thank you, Dr. Matyas. So yeah, I'm Dr. Pitzen. I am the director of the Clinical Psych Master's Program at RCU. And so I still have some involvement in terms of the undergraduate side of things, teaching a few courses here and there, but I spend a lot of my day on the graduate side. In terms of how I got interested into psychology, I think in the same way that a lot of people do, I myself was a fairly anxious child who starting from a very young age, just experienced anxiety here and there. And I became interested in learning more about anxiety and what that looks like, and to better understand myself, but also the people that I interact with on a regular basis. And so I took an introductory psychology course in college and fell in love with it, and knew right then and there that that was the path that I wanted to go down. So I completed my bachelor's degree, then went on to get my master's degree in clinical psychology, and then my PhD in clinical psychology. And my main area of focus, as mentioned before, is in young children and parenting. So I initially thought that I wanted to work with adolescents. I wanted to kind of focus on that age range. But then I also ended up having an opportunity to explore working with younger individuals, both on the research side of things, in terms of some of the work that I did with my thesis and dissertation, but also working face-to-face with young children and their families, in my practicum or internship experiences, as well as on my pre-doctoral internship. And that's when I really fell in love with working with young children and seeing how much a person can really shape a person's trajectory over time and their development by early intervention, and really making sure that they're getting the support that they need early on. And so that's kind of where I started in terms of my interests. So now, as the director of the clinical psychology master's program, I support all of these students that are planning on becoming clinical psychologists themselves once they leave our program. So that includes helping them, figure out what courses they're taking, but also things like helping them apply for their practicum placements, helping them think through their career options, helping them work on their research projects or theses that they're doing, and then also teaching courses that focus on things like child assessment, so how to assess and diagnose a child with things like autism or ADHD or learning disorders, and then also child therapy courses to help them understand how to diagnose and treat different disorders that we might see in children across the age ranges of, toddlerhood all the way through adolescence. So that's essentially me in a nutshell. So I can pass it over to Dr. Heidi Martin to tell you more about her.
And I figured out the video, so that's good. Okay, so I am Dr. Heidi Martin. So for me, my journey, I started at Rochester Christian University, actually. I was planning to be a high school teacher. That's what I had wanted to be since like second grade. Similar to Dr. Pitzen, I took a intro to like a general psychology course and fell in love with it. I did some research on like what kinds of careers I could have in psychology. Unfortunately, I was told that in order to do anything, I would have to have at least a master's or PhD, which, side note, that is not true. There are plenty of things you can do with a bachelor's degree. But because of that, I was like, okay, I'll do that. So I looked into it. Clinical psychology kind of spoke to me the most. I was really interested in the brain, but kind of the more research heavy careers scared me a little bit. So I was like, okay, yeah, I can work with people. That sounds fun. Applied and got into a program where it's kind of like a master's and PhD combined. From the get-go, I knew I wanted to work with adults, not children. And also, though, kind of at the beginning, it was sort of like I just want to do therapy. And then throughout the PhD program, I learned a lot more about other aspects that I can do with a degree in clinical psychology. So that's where I really fell in love with assessment. Assessment is where I kind of get into my flow. It like makes the most sense to me. I view assessment as kind of being able to put the puzzle pieces together for a person to help provide them answers and maybe a diagnosis. So that really guided the rest of everything. True to my original intent to be a high school teacher, I also got into teaching. So I was adjunct for a while at Rochester, and then this past summer I accepted and now am a full-time professor. So my day-to-day now kind of looks like juggling these pieces. So I do work in a clinic. I have a few adult therapy clients that I see. And then I am the director of psychological assessment. So I do a lot of supervision of other students, psychologists in training. And I write assessment reports and kind of run the assessment program there. And then at Rochester, of course, teaching classes, kind of mostly in that adult realm, but some other things as well. And I am the practicum coordinator, so helping the clinical master students find their practicums. And yeah, I think that about summarizes it. So kind of wearing different hats. I do something a little different every day, which is what I like. I don't think I could be the type of person who I have supervisors who had just 40 hours of therapy clients a week. I could not do that. So I like having, different things mixed in my day. And yeah, so I think that summarizes it. Okay, well, we got through that real quick.
That's all right. I do have some questions for you to talk about, and then we'll see if anyone else in attendance has any questions. Please feel free to drop them in the chat, and we'll share those with the speakers. But my first question for all of you is, you really shared about just the breadth of different roles and kind of experiences and just focuses within this field. So how did you know really that this was the right path for you? And how did you even get to understanding that there was all these options and here's the one that I'm going to pick? How did you go about that process?
We'll go through in the same order that we've been doing this then. For mine, I like to try to describe to people that I come from a long line of stubborn, angry women. So my journey really, I think, began in the ER when my mother had her injury, because out of about 5 or 6 different medical specialists standing around there telling her, you've had a spinal cord injury, you will never walk again, the first word out of her mouth was profane, so I will not share it in public. I saw that she was like, you don't tell me what to do. She would tell people I don't have an expiration date stamped on my foot. And so I was like, she's right. This is not black and white, that these things work on a scale. Everything counts as a spectrum. I even know one of my favorite professors in school told us that every diagnosis kind of counts as a spectrum, and it only becomes a problem if it interferes with your daily life. So it was like, yep, Dr. Lilliston was right. My mom was right. I'm going to step in and speak for the people who don't have a voice.
For me, I think it probably started when I started in my master's program. Again, kind of pretty much all through getting my bachelor's degree, I was pretty much focused on, I wanted to go into clinical psychology, but I was very certain that I wanted to work with teenagers, and that was where I wanted to work, and that was the thing that I wanted to do, and that I wanted to just do that full time. I was just going to be a full-time therapist working with adolescents, and that was the only thing I was going to do. And then I started in my master's program, and I started having more opportunities to do research, and the lab that I worked in was much more early childhood focused, and we worked also a lot with women that were going through pregnancy, and just sort of seeing how they've developed and grown and transitioned from being pregnant into the roles of being a mom. And so being able to work with those families and younger children, that's where I really started to kind of shift my interest from adolescents into younger children. And then also, similar to some of the previous speakers from this morning, having more specific opportunities to get involved with training. My first practicum experience was with college students. My next practicum experience, once I transitioned into my PhD, at an inpatient psychiatric hospital for children. And so I got to work with a wide range of children, from as young as 7 years old to 17 years old. And I started seeing how a lot of these children had been in various hospitals throughout their development, starting from a young age, all the way through adolescence, being in and out of different hospitals, having different experiences outside of that outside of the hospital as well, and just thinking about how there could have been a possibility that if somebody had maybe intervened early on in their life, when they first experienced a traumatic experience that kind of shaped the rest of their development, or figuring out ways to target both the child, but also the family environment that they were involved in early on, that maybe we wouldn't have as many of these children in these hospital situations, and to be in this kind of revolving door of being in a hospital and then being discharged and then going back into another hospital later on. And so again, that kind of really steered me towards wanting to work with younger children. And so then through my internship experience, that's where I got to spend all of my time working with children under the age of 7, and really figuring out that that was the direction that I wanted to go in. So having multiple different training opportunities and exploring different populations of individuals really helped me figure out the younger and younger ages. I just kept working backwards until I got to the youngest possible child I could work with.
I think for me, it's interesting. I was reflecting as my colleagues were talking. I feel like I didn't quite know that for sure this was the right field to me, for me until probably internship or afterwards. I did have some different opportunities, but it was like nothing ever fully clicked. The first practicum I did was at a neuropsychological rehabilitation center, and I did assessment and therapy. I loved the assessment, but I was like, these are really long assessments, 6 to 8 hour assessments. My second practicum was at a college counseling center, and that was fine. And then my internship also was there at another college counseling center. And I knew I wanted to work with adults, but like, I guess internship was very emotionally draining. There was a lot of clinical work. So I was basically like interacting with clients 18 to 20 hours a week, and then also going home and seeing private practice clients more. And so then by the time I got done with internship, I was like, okay, I am so burned out on therapy, really transitioned into focusing on the assessment piece. And that's where it feels like everything clicked, like, okay, this feels right. This feels like this is kind of the spot that I'm supposed to be in. I didn't want to like completely get rid of therapy. But I realized that just for my own mental health and well-being, that it was helpful for me to not see as many therapy clients. And I really loved the assessment piece of things. So I think I did appreciate throughout my program the opportunities, like Dr. Pitzen mentioned, like being able to do different things and kind of try on different hats, so that I could figure things out by the time I get into my career. So yeah, I think that was kind of my journey and coming to the realization, okay, I'm where I'm supposed to be.
Absolutely. Thank you for each sharing that. It's always interesting because in the conversations I've had with folks, it's very rare that someone from day one was like, this is what I'm going to do. And they had a very straight path. It's usually through those different interactions and different forks and experiences that someone comes across, this is really what I want to do. So I think that's really great to highlight for students, that you don't always have to know 100%. There's lots of opportunities to explore. And on that kind of note of exploration, it sounds like a lot of it happened in that kind of internship and practicum stage. Are there any experiences and resources that you know of that might help someone to kind of dip their toes into the water and see, maybe this is what I want to do, try this hat on, see if this works, and then kind of go from there?
In my field, though, too, since mine was mostly experimental, I will be honest enough in saying I also kind of dabbled a bit before I finally got into a graduate program. I did a year of what we kind of casually call a post-bac or the post-bachelor's education, I started taking a couple classes, and I volunteered in a lab in order to gain some research experience that allowed me to get into that program. Before I did that, though, I chose a school that kind of fit my interests, and then I just kind of went to the lab directors and said, do you need an extra set of hands, because I want to learn more about this stuff. And once I got in there, once they got to know me and how well I could stick to protocols and follow these things, they allowed me to join the program the very next year.
Yeah, I would say, thinking, if this is a person that's still in high school and is maybe trying to figure out maybe where they want to go next, taking advantage of whatever opportunities are available. And, those could be, like the previous presenters talked about, not necessarily direct clinical work that you might be doing with a person, but maybe just volunteering with different communities, working with different people. That could even be, if you are interested in, maybe you want to work with children, but you're not quite sure, doing some work with children, whether that's volunteering in different roles or maybe working in a school in different capacities to where you have exposure to children and you get to really figure out whether that is a group that you really want to work with or not. And then as you are kind of, if you're transitioning into college, taking advantage of different coursework that's available to you. So, here at RCU, we have courses that go over things like psychotherapy and counseling, and we have experimental psychology, and we have developmental psychology, and all of these different courses that you can take that I think really allows you to dip your toes in the water and see if this is something that feels comfortable to you, is something that you're really interested in, something that you want to explore further. And also, and again, as you're transitioning into college, thinking about other volunteer opportunities that you can do. And so those, again, might not necessarily be working one-on-one with individuals, but it could be doing something like working as a behavior tech with children with autism. It could be something like volunteering for, suicide hotlines and things like that, where you get an opportunity to work with people that are in crisis or just struggling in different ways. And again, figuring out if that is an area that really kind of speaks to you and is something that you want to pursue further.
I don't even know if this is something that would be possible, but it's the only other thing that came to mind besides what Dr. Matyas and Pitzen discussed is I feel like for me, doing the research helped. So maybe for high school students, they could look into what does it mean to be a clinical psychologist? What kinds of things can I do? Looking into these different areas to kind of try to get an idea. I'm sure there's all kinds of resources online for that. And then the other thought I had was trying to reach out to see hey, can I come and shadow you or just talk to can I talk to you about what your day-to-day looks like and tell me what the career looks like, tell me what grad school looked like. I feel there's got to be some psychologists out there who would be willing to do that. Usually, the previous speaker said, there's HIPAA and there's other things with shadowing directly with clients, but just having a discussion sometimes can be really helpful to just know a little more of what that looks like. And I feel to me, if I were to hear that a student did that, I would think, wow, they really have initiative. They really want to learn more about this career and field, and they're putting the effort in to do that. So that's the only other thing that came to mind for me.
Bouncing off of that too, the American Psychological Association has a ton of different divisions that they're called, and they all explore different areas of psychology. So there's a division that looks specifically at child and adolescent psychology, Division 53. There's a division that looks specifically at teaching, if maybe you want to move more into the teaching side of things. Division 2, there's divisions that look specifically at adults, health psychology, experimental psychology, sports psychology. And so those could also be good avenues to just kind of search on the APA's website for those different divisions that are available and explore their websites and learn more about what sort of opportunities they have. They will also sometimes have different webinars and trainings and things like that that you can sign up for and watch. And so that can be also another great way to explore all of the different facets of psychology that are out there and what might work best for you and your personal interests.
Perfect. That's great. Thank you. We're coming up on time, so I'm going to pose kind of our last question for each of you to answer, and that's, what characteristics do you think would help someone to be successful if they chose to pursue your specific specialty within psychology? And then if there's any last piece of advice or commentary that you would like to share with the attendees today.
I would say for my area, the number one skill I always try to teach in our classroom is attention to detail. There's a lot of times we even, like right now, I'm teaching the senior research projects for our undergraduate program, and I have all of them highlight to me, what are your experimental confounds? What are the outside influences that are going to change the way somebody answers your survey? Even if it's just survey-based research, something else is going to change the way this person answers. And being able to understand where they're coming from, identify any little influences, and even just making sure that the way that you ask a question is sensitive to where they're coming from will get them much more information than if they were not to look for that.
I would say if you're really interested in working with children, you should probably really love children for the first part. And then to that, also having a lot of patience, both in terms of working one-on-one with children, working with families, having the ability to be very patient and very composed, even when a child is throwing a tantrum or chucking a toy at your head, like whatever it might be that could happen in the course of a session. Being willing to have that patience and loving being with children enough to kind of want to be in that on a regular basis, while also noting that they can be really fun and funny and great to, if you just want to hang out and play with them too, you get to do that too. So there's good things to working with kids too.
I would say what comes to mind for me in terms of like characteristics are just openness and empathy. I think in one of the graduate interviews, there was a question that came up about like, I kind of asked this of, is there anyone you wouldn't work with? And the answer to that is supposed to be like, no, I'll work with anyone. And kind of the aspect of that is that even if you don't agree with this person's, political views or religious views or sexual orientation or anything like that doesn't matter. They're still a human being. You can have different opinions and still have empathy for them and be able to treat them. And so I feel like that's just a really important component and comes to mind the most with adults. And then in terms of advice, the thing that comes to mind most for me is, to just keep going. Like you can achieve anything that you set your mind to and put the effort into. And like, if I were to tell, high school me or like entering college me, it would be to like trust yourself. Cause I feel like that imposter syndrome and like low self-esteem is the thing that always like gets me basically. It kind of just makes things harder. So if you're able to build that, it'll really help you. Like it'll go a long way. So yeah, easier said than done, but.
No, thank you. That's all great. And I love that you each picked different characteristics and aspects. I think that's really, really great to highlight for students. Thank you all so much for sharing your time and experience with us.